everyone. I wanted to talk to you guys about my very first clinical experience of physical therapy school. I was in an outpatient setting, which means that I was not in a hospital. I wasn't in a place where we have physicians on hand in case anything serious were to happen. So, an outpatient setting usually can be a private clinic, it can be a type of clinic where there are multiple locations of the same exact clinic. I was personally in a private one, and I saw primarily people with joint replacements. For example, knees and hips were my two primary ones. A lot of the patients came in for low back pain, neck pain, frozen shoulder, shoulder pain, post surgery for something like thoracic outlet syndrome, a lot of ankles. So there was a good wide variety of different types of patients, and I got to work with a lot of them. During my time in clinic, I worked a 40-hour work week. I was doing 4 days at 10 hours each. I was seeing 2 patients per hour. So the way that that worked is that for the first 30 minutes, it's manual treatment, which means that the clinician is hands-on working with the patient, and then the next 30 minutes, we will go to the aide and we will let them know the exercises that were prescribed for the patient, and then the aide will then work with the patient from then on, keeping time, making sure the patient is doing their exercises correctly. Multiple times throughout this clinical rotation, I've had to go up to the aides, make sure that they know that the exercise was not being performed the way that I would have wanted it to be, and then cueing the patient on how to do it properly. So the entire 1 hour, you're working with the patient. The first 30 minutes being hands-on treatment, and the next 30 minutes being you're monitoring the patient while they are in the clinic. There is something to be said about making mistakes and how mistakes are your best learning experience. During my time in clinic, my CI, my clinical instructor, who is my supervising physical therapist, who is licensed, versus me, who is a student, he was asking a lot of questions, and sometimes I would get the answers incorrect to those questions, and that's okay. It's a learning experience, and being a first year, physical therapy student, there are some gaps in my knowledge still, and so it's pretty okay and 100% normal to, after you have seen the patient, to then go back and check your notes. It really enhances the learning experience when you're asked a question right on the spot, you get it wrong, and then it really sticks to you for the next time, and you're definitely not going to get it wrong the next time. So since my experience happened during COVID, masks were required, of course, for every therapist working, every patient working. Even when the patients are exercising, it was imperative that they kept their mask on the entire time. Due to COVID, we had usually 4 to 5 physical therapist staff members in the clinic at one time. But because of COVID, they had to stagger the schedules a little bit more so that there were less number of people in the clinic at any given time. That didn't really impact my learning in any way. I was always with my CI, working under the same person every single day, and we were seeing a full patient caseload every day. Some things to consider when you are in your first clinical experience is trying to figure out what is your learning style. So some people might learn best if they're just thrown into a situation, and other people might learn best if they get a day or two to observe and sort of be a fly on the wall and really kind of figure out how the clinic works. Personally, for me, I was sort of just thrown in the very first day, and that worked out okay for me. I was able to get stuff wrong, I was able to get stuff right, and those moments were really, really impactful. A lot of emotions involved, of course, because your heart is beating fast, you've never seen these patients before in your life, and you've never really worked with real patients before in your life, and this is a whole new experience. Pretty much, you're also able to then communicate with your CI and let them know what your learning style really is, and work with them about what their teaching style is, and how to figure out where both of those things will align, and allow you guys to figure out where both of those things can align, and allowing you both to be receptive to each other's communication styles. What was really cool about the clinical experience is really noticing the difference from your very first day of clinic to your very last day of clinic. The very first day of clinic, I almost felt stupid at times. I felt like as if I didn't know a lot of the things that I was, supposed to have known magically. And it turns out that it's okay. On the very last day, I actually left the clinic feeling very, very knowledgeable. I know that I can handle a full day's patient caseload by myself if need ever be. Something that was interesting that happened with me was that my clinical instructor called out sick for 2 days throughout my clinical experience. And of course, because of COVID, if someone has like a runny nose or someone has a little bit of a sore throat, like there's no coming into the clinic at that time. And my CI gave me the choice of whether I wanted to see the patients for that entire day. And I said, yes, I'll do it. And that really allowed me to become more confident in my own skills, whether they be manual skills, whether they be prescribing the exercises, or whether it was me just being able to build that rapport with the patient that they trusted me enough to be seen by me. It really, really helped with my learning experience. A learning strategy that I would give you guys advice on is when you are asked questions by the CI, it's normal and it's totally okay to ask multiple questions if you need to, as follow-up questions if you don't understand what was previously being asked. For example, I sort of realized after about 4 to 5 weeks of my clinicals that I should be asking clarifying questions so that I don't always just get the answer wrong to whatever question that the therapist asked. So I was then able to ask clarifying questions anytime that he asked me a question. And that way, not only did I really start getting the questions correct, I was also able to then sort of tease everything through my brain to figure out what is the right answer to what this clinical instructor is asking. So I'm going to leave you guys with 3 pieces of advice. These are things that I learned. One is to be open-minded. Everyone's clinical experience is very, very different. We have about 46 students in my class, and every single person's experience was different. Some people saw babies, some people saw farm workers, some people saw people who hurt themselves while surfing. And it was just a very wide variety of populations that you'll end up having. So be open-minded about the type of population you're going to have. Be open-minded about the learning experience you're going to end up having. A lot of that learning is shaped by who your clinical instructor is as well. So everyone's, not the same exact person. Every student learns differently and everyone teaches differently. So be very, very open-minded about just this entire learning process. And if there's anything that, is not very comfortable for you, speak up and let your program know, let your clinical instructor know. Just to have like that nice open communication is going to save you a lot of time and effort that could be put into helping the patients instead. The next thing would be don't hold grudges. There can be a little bit of misunderstandings. There can be just 2 different rules of thought when it comes to treating a patient. Not everyone treats the same patient in the same exact way. You might have a different way and your clinical instructor might have a different way. Don't hold a grudge if you guys sort of have some sort of a misunderstanding or have a little bit of a back and forth about how to treat someone or about anything else really, because in the future you're going to continue to work with these people, whether it be the patient population, whether it be the clinical instructor. You're going to continue to work with them. They are your colleagues. So really learning to be professional and not sort of holding any kind of a grudge and just sort of moving on throughout the day and putting a smile on your face and just moving on. So those were my little nuggets from my clinical experience. If you guys have any questions, feel free to go ahead and comment down below and I will try to get back to them. And thank you so much for watching. I hope you guys learned something. Bye!